Good morning, everyone. It's another rainy day in Erie. But that's okay because it kind of fits my mood right now. I struggled with whether I should do this video and whether it was appropriate and if, necessary. But the more I thought about it, the more I realized that I need to show that I'm standing up for myself and not being treated like I was yesterday. As many of you know, I've had major issues with my foot since like 2001. I've had ankle reconstruction surgery and surgery to remove a large number of cysts. The surgeon lost count of how many cysts there were. In the midst of all this, I got sent to a pain specialist. I'm not going to say his name. That I'm not going to do. But I'm not... So, I went in to see him, and he talked to me about getting these injections in my back, and I refused. That scared the crap out of me. I'm not doing that. Well, we tried gabapentin, and the only thing it did was make me gain 20 pounds in 2 weeks. So, because it wasn't working, and the other side effects, I told him I wasn't taking it anymore. Well, he said, I wish you'd let me do the injections. Your pain would be gone immediately. So, things with my spine freak me out. I just, it does. And so, when he said the pain would be gone immediately, I said, fine, let's do it. Because, well, I'm tired of dealing with it. And it worked. And for almost a year, I had no pain. And then we were in a car accident and got rear-ended. Well, I was bracing with my foot, and the insurance covered having another injection done. So the pain specialist told me not to come back until I felt pain again. So I didn't. Well, in the meantime, the doctor went from private practice to a Highmark Allegheny practice. And my insurance is the UPMC. So I didn't think I could go to him. Well, after about a year of being in pain and not being able to stand it anymore, I called my health insurance and fought with them to get him approved so that I could go back and have these injections done. So I go back in like February, March, and told him, why I was there, that I want to get these injections done. And he said, well, we don't have any imaging, we don't have any anything. So I said, okay. And he sent me for an MRI, and because something did show up on that, I had to go get a CAT scan. And I hope you can hear me over this rain. But, so I went and got the CAT scan. Ended up in an accident on my way. Some broad sideswiped me. Took a month to get my car fixed. It's insane. But, so, turns out I have a tumor in my foot. It's a 50-50 shot if it's cancer or not. So, went to the surgeon, and he said that he didn't want to do the surgery unless it was absolutely necessary. So, okay. Went back to the pain specialist because of an appointment. It was already scheduled. He wanted to see me. So, I'm going to say it was March or April. He started me on Vicodin, which I get 30 of them the low ones, the 5 or whatever. And it doesn't take away the pain, but it makes it bearable enough that I'm not, completely sitting on the couch not moving. I've gained almost 40 pounds this year because, 2 years really, since my foot has been hurting because I waited the year. And so it helped me, be able to get up and be more active and be able to do stuff. So, even putting a sneaker on hurts my foot because of the compression around it. So even though it's raining today, I'm in my sandals because I don't want to be in pain. Anyway, so I went for my appointment yesterday, paid my $40 copay again, and I went in, he comes in and he starts talking to me. Well, he moved up my appointment, the last appointment, because he was having surgery. So, okay, I went to see him when they rescheduled me, and then made a follow-up appointment. Well, then his office called and said he wanted me to be rescheduled. Okay, so it was supposed to be September, but because of end of month and end of year and secretary calling off, I had to reschedule it. So went yesterday, and she or he, whichever, said, started talking to me about this implantable device, this spinal stimulator, pain something or other. And I told him that scares the crap out of me. I don't want anything implanted in me. And I asked, I said, I have a true nickel allergy. I can't even wear surgical steel. Is that okay for me? It's like, well, I've only heard of that once. That's very rare. I doubt you are. And I said, would you like me to, bring in a pair of surgical steel earrings so you can see what it does to my ear? And he just kind of looked at me, and I was like, and then he starts going on and on about the Vicodin. You're going to lose your kids. You're going to lose your house. You're going to stop taking care of your kids. And I said, well, what? Like, I have never asked him for any more than the 30. I have never needed more before I ran, the end of the 30. I've actually pushed my, being able to get a time over almost 20 days because I don't get it. I don't take it as much as prescribed. Only when it's really, really bad. And he's telling me that I have drug-seeking behavior, and that once I get that on my record, that no doctor is going to want to see me. I'm not going to be able to get a primary care physician. That, I'm just floored. So at this point, I actually stood up for myself, and I don't do that. I usually let people treat me like crap and just roll with the punches. This isn't the first time he's said stuff like this to me. It isn't the first time I left his office sobbing. Fourth or fifth time, actually. But I thought I had no choice. And I've had enough. So I said to him, why can't I'd rather have the surgery to remove the tumor than to have the stimulator thing. And he said, you'd rather have surgery that could alter your life forever than have this implanted. Yes. Why not get rid of the problem that's causing the pain? Or at least try to get rid of the problem that's causing the pain. If the pain is still there, then try something else. I don't want it. And I said, And he went on again about the opioid epidemic and all this stuff. And I told him, I said, I understand. I'm a social worker. I see this every day. I know. Like, I'm not stupid. And he just looked at me and he's like, I don't understand why you don't want this stimulator. I said, because I don't. That freaks me out. He goes, well, everybody has their things, I guess. And I was like, so then that kind of really irritated me. And I went, well, I said, I fought with my insurance company to come back to see you so I can get the injections. Why can't I get the injections? And he looked at me and literally dropped the F-bomb. And I was like, stunned. I mean, I've heard, doctors swear in like the room or whatever, but that doesn't normally bother me. But that bothered me to no end. And I said the nurse happened to poke her head in at that point. And because I seen him from the injections when he was at his private practice, he didn't have it. So, my records. So the nurse came in, and I was, crying at this point. Cause, the doctor just turned around and left after he dropped the F-bomb. He just turned around and left. Never came back. And then he's like, or she comes in, she's like, we're trying to find your records. I can't locate them. So I was crying. And I said, well, it was done at the surgery center. Maybe my PCP has record of it. I'm sure he got a report. Would you like me to call them to see if they could, fax something over? And she said she would try to get it from the surgery center. And she left. And at this point, I just lost it. And she come back in to tell me that, they were going to fax it over, but she wasn't sure how long it was going to take. I said, that's fine. I just went out of here. I don't want to be here anymore. I need to go. And she just kind of looked at me and she said, are you in that much pain? She thought I was crying because I was in pain. And I said no, and I told her what happened. And she gave me the office manager number. And so I'm gonna call today. I feel better and like I can actually keep it together without crying, since I've been able to do it so far. But I was a mess. So I feel bad because I don't want him in trouble. I don't want, but I can't I have to stand up for myself this time. And I can't let him treat somebody else the same way, because if he's doing it to me, he's probably doing it to other people. And someone's got to say something, and I'm going to. But I'm not doing it lately. I've thought about this and thought about it. I didn't really sleep much last night. I couldn't fall asleep last night. Because all I kept thinking about was, having to call him today. I don't want to go back. It ticks me off that I paid $40 for nothing, but to be treated like crap. And, again, but this is the worst. And nothing come of it. Nothing came of it. I'm shocked, and I don't even know how to respond. So much so that I actually called my mother-in-law and asked her and told her what happened and asked her if I was overreacting, because I know I can overreact on certain things. We all do, but, and she agrees with me that I'm not. And she also knows this isn't the first time he's treated me like this. Although yesterday was just, I'm done. I'm done. But the purpose of this is you do have a voice. You don't have to be treated. I felt like I had no choice. But he was going to be the only one. He's the only one that could do the injections in Erie. I felt like he was my only option. So I continued to let it go on, and I never should have. Speak up. When somebody treats you wrong, when somebody makes you feel like crap, don't let them do that. Don't speak up. Do something about it. This feeling is horrible. But I'm going to do what I need to do and take it as far as I can go, because I'm not letting him treat anybody else like that. I'm just not. So, anyway, I love you all. Thank you for listening. Like and share. Everybody needs to hear this. They need to know that they can have a voice and stand up. And that, you know, they matter. And that it's not right if they're being made to feel that way. So, love you all. Hope you have a good day. I'll update later, maybe on lunch when after I talk to the person, if I talk to him at that point, the office manager, and give you an update to what they said or whatnot. But, okay, let's get this day started. Love you. Bye.